In the state of Minnesota, we're required to have a community health board as part of the way in which we protect our counties for emergency preparedness. In addition to being the public health director, I also serve as our county's Public Health Emergency Preparedness Coordinator. The Public Health Emergency Preparedness Coordinator is responsible for ensuring public health protection for responding to emergencies, education, and prevention, like the storm that we had on June 21st, 2025. Public Health was responsible for setting up a shelter. And part of that shelter responsibility included not just housing people, but providing health triage to them, feeding services, and a resource center to be able to provide supplies for them. It's so important to have an emergency response plan for your own family, whether you're an individual or you live with multiple people. We've created North Country Nuggets in partnership with Hubbard County, Clearwater County, and Lake of the Woods. We have a really nice one-page document for winter preparedness and the things that you might want to have in your house. Some of those items include having a first aid kit, some emergency medicines, emergency flashlights, extra chargers for your cell phone or items that need charging, or backup batteries is also really important. Having extra extension cords, and having a plan with your family. Public Health is really working hard in our collaboration as a community health board between our 4 counties to provide education and training to individuals and families to help them be more prepared. We have a coloring sheet where kids can draw out an emergency escape plan if there was a fire in their house. So attending public health trainings, they can sign up on our websites, whether it's through the public health website or county's emergency manager's website. You can sign up for alerts, responses, code reds, and there's also a place to sign up to be a volunteer. We work really hard through our training and our education to teach people about the incident command, how to respond, and how to recover. In that recovery phase, public health is really responsible for being a resource and a guide and a support. One of our biggest struggles in emergency management and emergency response and emergency preparedness is really helping our community understand misinformation. If you can attend our trainings, if you can be on our websites, if you can sign up for our alert systems, you're going to be more prepared in knowing how to respond, but most importantly, you'll know where to get the right information. People that you can trust and rely on are going to be your emergency managers, it's going to be your sheriff office, your police office, your public information officer, and then also your public health team, because those are the individuals that get that first line training into incident command systems and the emergency response. When people don't have an emergency plan for how to protect themselves in emergencies, because there's certain things that the county or the local government or the city or your township just can't provide support for, and we'll do the best that we can by training, by being prepared for ourselves. We need people to have these backup plans for themselves, so in the event of an emergency, they're prepared within their own dwelling place.